SRL analysis arthritis prevalence rising among Indians. An analysis of arthritis in its laboratories by India's leading diagnostic chain SRL Diagnostics has found that more women are suffering from rheumatoid arthritis than men in the country. In the analysis, it has also been shown that compared to the northern zone, the inflammation of the ESR and CRP levels in the eastern zone and the swelling of the joints is common in patients with arthritis. At the same time, the level of uric acid has been found to be higher in the northern region than the eastern zone. These figures are based on 6.4 million samples for the investigation of arthritis during the last 3.5 years from January 2014 in SRL laboratories of India. More than 180 million people are affected by arthritis in India. The number of these cases is higher than many other diseases such as diabetes, AIDS and cancer. About 14% of India's population takes the help of doctors every year to treat this disease. Lab test. Blood tests are only helpful tests for the diagnosis of arthritis. 1. Inflammation test. ESR, erythrocyte sedimentation rate. CRP, C-reactive protein. 2. Test. Rheumatoid factor for rheumatoid arthritis. 3. Gout, that means uric acid for arthritis. Osteoarthritis. Osteoarthritis, the most popular form of arthritis, affects 15 million adults every year in India, and thus its circulation is 22% to 39%. Apart from this, arthritis and rheumatoid arthritis are also commonly found in Indian population. Osteoarthritis is found in most women, and with the increase of age it is likely to increase. Studies have found that about 45% of women over 65 years of age have symptoms, whereas 70% of women over 65 years of age have found radiological evidence. Rheumatoid arthritis. An autoimmune disease usually affects the tissues present around the joints. Generally, this disease, found in adults, affects about 0.5% of India's 1% population. In women, its cases are 3 to 4 times higher. It is often in the 35 to 55 age group. Gout or arthritis. The most common form of inflammatory arthritis is 3 to 4 times the probability of rheumatism in men, and it is found at 50 years of age or older. The main results of the study. The abnormal ESR and CRP levels were found to be found in the eastern zone, which indicate swelling of the joints. Compared to other parts of the country, the results of these trials have been found to be more unusual in patients of these areas. CRP 61.23%, ESR 53.78% and RF 14.34%. The unusual level of uric acid shows arthritis, which is found in the northern zone, 23.19%, and then in the eastern zone. After the age of 40, patients with ESR 56.71%, 61 to 85 years, CRP 80.13%, over 85 years of age, RF 12.77%, 61 to 85 years, and UA 34.76%, 85 years of age, levels have been found to be abnormal. Dr. Avinash Farke, President, Scientist and Mentor, Clinical Pathology of SRL Diagnostics said, although the word arthritis is associated with swelling of joints, the word used to affect more than 100 rheumatome diseases, bones and tissues, is used for diseases. According to an estimate, by 2025, India will become the capital of the world with more than 60 million cases of osteoarthritis. Ironically, this is one of the main reasons for the growing age of Indian population, and the other main reason is obesity. Initially, symptoms that are not visible should be ignored. By timely diagnosis and treatment, you can save your joints. The good health of the joints is important to maintain the quality of life of a person.